Hello friends, how are you? I hope you all must be fine. Today I am going to talk about a very important topic, that is X syndrome. Most of the times we think that diabetes, hypertension and cardiac disease, that is coronary artery disease, kidney failure and cancer, are different diseases. It's absolutely true that these all are different diseases, but do you know that the main cause, the prime cause of these all diseases is just same? Yeah, absolutely. That is X syndrome. Now, what is X syndrome? X syndrome is just associated with the increased triglycerides, increased LDL, low HDL, high insulin resistance, and central obesity. So, if you have these all the symptoms, that is an indicator that you are developing X syndrome. So, how can we predict that you are suffering from X syndrome or not? So, the best predictor of X syndrome is that if you have high triglycerides and low HDL, that is the best or that is the best sign to show that you are developing X syndrome. So how will you manage it? You just have to take your lipid profile, and if you have triglycerides and HDL ratio more than 1, if triglycerides and HDL ratio is 1, that is quite good, and if it is 2, that is also acceptable. That means if triglycerides are just double of HDL, high density lipoprotein, that is also acceptable. But if it is more than 2, it is an indicator that you are developing X syndrome. And if it is more than 5, that is you are at high risk of cardiovascular disease, that is coronary artery disease. So you are prone to heart attack or diabetes and hypertension. So you will have to just maintain your triglycerides and HDL ratio below than 1. That means triglycerides should be lower than HDL. So that is best. But if triglycerides are just double to HDL, that's also acceptable. But if it is more than 2 or 3, then it means that you are at high risk of diabetes. You might be pre-diabetic, or you might be hypertensive, or you are just going to be a patient of cardiac disease. So be alert and don't neglect the early signs of X syndrome. Thank you so much.